All right, so this is section 4 of chapter 3, and in this section we will discuss modalities of measurement. Okay, so recall our conversation about constructs or hypothetical constructs. So psychologists, when studying things like motivation or intelligence or self-esteem, are dealing with constructs that can't be directly observed or measured. So your job as a psychologist, if you want to study one of these constructs, is to figure out the external manifestation or external expression of this construct. And broadly speaking, these external expressions can be classified into one of three categories. The categories are self-report, physiology, and behavior. So for example, let's say you want to know if somebody is afraid, if somebody is experiencing fear. And fear is a hypothetical construct. You actually can't see it or measure it directly. You have to look for some external manifestation or external expression of fear. So using the three categories that we mentioned, one option is self-report. You can ask a person, are you afraid? On a scale of 1 to 5, let's say, of something. Two, you can use physiology. Maybe you can measure heart rate. Does heart rate go up when a person is presented with a stimulus that potentially induces fear? Or three, is behavior. Does a person avoid or run away or freeze up when in the presence of a stimulus? So behaviors that may indicate fear. Okay, so those are modalities of measurement, and we'll talk about each of these in a bit more detail. All right, so of the modalities of measurement, the first one we'll talk about is self-report. And this is simply when you ask people direct questions regarding the construct that you want to know about. So the example we used was fear. And with fear, you can ask somebody, were you afraid of this stimulus in this situation? Were you scared? And you can use a scale of 1 to 5 or some kind of a questionnaire. Now, there are a number of advantages to using self-report. It is pretty straightforward. It has high face validity. It is often the most direct way to access the construct that you care about. And many people have the requisite self-knowledge and self-awareness to correctly provide the information that you may want in a number of different situations. So many people know what they are afraid of, what they like, what they don't like, what their beliefs are, etc. Okay. However, there are also a number of limitations or disadvantages to using self-report. First of all, the responses can be distorted in a number of ways and for a number of reasons. First of all, if you have people answer questions, the way that the question is worded can often elicit different responses. So there's something called the framing effect in psychology. And the idea is basically that the way that you frame a situation or a question or a scenario can change the way people respond or assess that question or scenario. Also, people might give you false information, either because they are lying to maintain a positive self-image, or because maybe there are limits to self-knowledge and self-awareness. So for example, let's imagine you ask somebody about bias. You want to know about bias. And you ask, are you biased towards some group of people? Now, you might imagine that there are people who would just lie. They lie because they want to maintain a positive image of themselves. They want to present a positive image of themselves. They don't want to reveal certain demons that they may have. So some people will just lie to you. But also, some people may be unaware of the fact that they may be biased. And so they will tell you, no, I have no bias, believing their answer to be truthful and authentic, where in fact the bias may be unconscious or subconscious. So in these situations, right, because there are limits to self-awareness, self-report may not give you the most accurate answer in the context of your construct. And also, this involves understanding language. And so if you're dealing with populations that are nonverbal, people with various disabilities, this can be a problem. Or if you're dealing with animals, you can't ask a rat, are you afraid? You have to rely on other measures, other manifestations of constructs. Okay, so next we have physiological measures. And this is when you measure the physical manifestations of a construct. How does a construct like fear affect your physiology? And here, there are many, many techniques that can be used. Some measure changes in the autonomic nervous system, so arousal in the body, things like heart rate, blood pressure, perspiration, pupil dilation. And again, all these changes usually are modulated by somebody's mental state. If you're afraid, it will change the physiology of your body. Also, techniques like PET scan or fMRI allow you to measure brain activity, the way that the brain responds, which areas become active to a stimulus or a condition of some sort. Other techniques like EEG or MEG also allow you to measure brain activation over time in response to some stimulus. So the advantages of physiological measures is that in some ways they're more objective and more accurate and more reliable. They may be able to get beyond the limitations of self-awareness. They may be able to access things that you're not conscious of. They don't require the use of language. But there are also disadvantages as well. So oftentimes, being in an fMRI machine is a very unnatural situation. Also, some of these techniques are kind of expensive. fMRI scans are very expensive. They also require training. You have to train, you have to know how to use these instruments. And also training in data analysis. And sometimes data analysis can be very tricky and complicated and take a long time to learn. And so especially with something like fMRI, which measures, again, brain activity, there are many ways of analyzing the data. And depending on the analysis adventures that you choose, the results may be different and they may change the conclusions and the interpretations that you form. But also interpreting what the physiology means can be challenging. Again, if you find activation in some part of the brain in response to some stimulus, what does that mean? What are those brain areas doing? How do you interpret activation in those areas as opposed to some other areas? And even, something like heart rate, if your heart rate goes up in response to an image, is it because you're afraid? Is it because you're excited? Is it because you're intrigued? These physiological measures are also difficult to interpret, and there's really never a one-to-one correspondence between a pattern of physiological responses and some mental state. And finally, we have behavioral measures. So this involves measuring behaviors that are thought to be related to the construct. So for example, if you are measuring fear, a related behavior may be the willingness to approach a certain stimulus that you're afraid of. So let's say you're trying to treat a phobia, let's say arachnophobia. Maybe you measure how close a person can get to a small spider or how much time they can spend in a room with a spider. And maybe following treatment, those measurements begin to change in a way that suggests that the person has less fear of that stimulus. So behaviors can be structured or they can be natural events. For natural events, maybe you observe people playing, laughing, arguing, eating in some natural or quasi-natural setting. Or behaviors can be structured events, like having somebody perform an IQ test or some specific test or task where you measure response time or accuracy, again, within some experimental task. Now, the advantages of the behavioral measures is that you have a lot of options to choose from. And behavior can reveal many things that self-report may not be able to. There's what people say, and there's what people do. And those don't always align, do they? So for example, let's say somebody claims that they don't have any bias of any kind towards any group. That would be a self-report measure. That's what they say about themselves. But then let's say in some structured experiment, they are less likely maybe to donate money to someone from a different ethnic group. So here's an example of self-report and behavior telling you two different stories. And one can argue that the behavior is a more authentic measure of the individual's true beliefs and priorities. Now, the disadvantages of the behavioral measures is that behaviors may be a temporary or situational indicator of a construct. So imagine a student who is a sweet goody two-shoes at home with the parents, but becomes a malicious bully in some other setting. So we as humans are sort of chameleons. We can shift into many different modes and play many different roles, each having its own unique repertoire of behaviors. So it is not clear the extent to which any one behavior really reflects the underlying construct. So for this reason and others, it is often better to measure clusters of related behaviors as opposed to just one if the situation permits.